is not the same as what is community language. So I think we need to work to make it culturally sensitive, and also the language that we use, it cannot be medicalized language. So I think that is important. And also, engagement has got to be on going outreach and on their terms, not on our terms. And that would be quite an important thing to do with the strategy as well.
Thank you, Alice.
Thank you.
Thank you. And Helen Williamson had a question. Oh, apologies. I thought you had your hand up there. Apologies. Sorry, Dan.
Not a question, just a commitment that really keen to work with you. Obviously, mental health, inpatient discharge and transitions, really high risk area on a national level for the suicide prevention priorities. Really need to make sure that we are echoing and supporting what is happening within the crisis system. So looking forward to working with you and aligning those strategies.
Andy Jachersky had a question.
Yeah, thanks, Andy Jachersky, GP. Catherine, thank you for that. I couldn't see it, but it might have been somewhere in the strategy, is the use of mental health practitioners working in our primary care networks at neighbourhood level. We've been fortunate in my patch in Caversham to have that. We'd like more, and I know there are other primary care networks, which are the groups of GP practices, for those who don't know, working together, who haven't got those yet. So I know it's been a challenge to find suitable mental health practitioners with the right skills for working in primary care. But I think going forward, I think if the strategy is long term, I think a commitment to that and in enlarging that workforce, and also as we had the children's mental health theme earlier on of looking at children's mental health practitioners as well. As we know from the COVID pandemic, a lot of mental health in children has come out, has been also brought out. I think if we can catch that lower level mental health earlier in the community, then we can reduce those referrals into more specialist services and all those long waits and difficulties that we all know about. Thank you.
Alison had a question.
Yeah, it was just a comment really on language, and might be worth just asking in the consultation, but some feedback we've had in some of our discussions is around grouping learning disability and autism in the same category. There'd be people in either that would say that they have very different needs, and so I just wondered whether that's something that you could explore when you're talking to people. Thank you.
Can I just come in on that point? Actually, interestingly, internally to us, we don't combine learning disability and autism as a set of services, but I do take your point. I suppose the thing for us is making sure we're really clear when people might have a number or sort of comorbidity or more complex issues, which mean they might need support from a range of different practitioners or different teams. But I think it's a really important point. Thank you.
Catherine, did you want to respond to any of the questions or points raised?
Yeah, please. So thank you. Really hugely helpful to have the comments and suggestions. It's always fantastic to have some fresh eyes on things. So Deborah, absolutely, totally. I've written your name down, and you will be included in any of the engagement events for children and young people. Alice, you're absolutely totally right about language, and that's one of the reasons why I've reached out to the voluntary community sector to facilitate those engagement events on our behalf. One, because I think we want to build those bridges and build that trust with our communities, and two, I think it's, language aside, I think it's probably easier for a voluntary community sector organisation to secure feedback on our services than it might be for us. It's that little bit of a critical friend, independent high type. So that's part of the reason why we are working with our CVSs on that. Andy, in terms of mental health practitioners, yes, you're absolutely spot on. We do need to include that within our strategy. and it is a really important part of our workforce development going forward. So yes, thank you for highlighting that, and Tamina's already come back on the last point. So super helpful to have all your thoughts and feedback, and I'd be really keen for you to stay engaged in some of these events as we go forward and develop the strategy going forward. Thank you.
Thank you, Catherine. I really welcome the update and the development of the strategy. Mental health is a key area that obviously spans and impacts all of the partners' work, so it's very important to get this right. So it'd be interesting to arrange for you to come back to the board and update us on the progress and the work that's happening. So thank you very much for your time today. Thank you. Right, then it's 3 hours in, and I'm sure everybody's a little bit tired, but we're up to agenda item 13, which is the Royal Berkshire Hospital Redevelopment Building Berkshire Together update. And we have Alison Foster here, not online, as my note said. So thank you, Alison.
Thank you. Yeah, so I'll it's just a very few slides to get people on the same page. I think it must be almost a year since I came last time to bring an update, and some things have moved and some things haven't. So just to bring everybody up to speed, one of the first things I wanted to say is to check out our website. We are trying to keep that very dynamic and live. So we've got weekly updates that go up there. We've got videos of previous events, and it's not just events, but any meetings that we're attending. So we're trying to make so people kind of feedback to us that is a bit of a mystery of building a hospital and what's involved, and are a bit fearful of getting engaged in case they think it's too complicated. And actually, there are lots of different ways that people can get involved and get engaged. And so for us, we want to spend quite a bit of time on sharing what we're doing, who we're talking to, what are the topics that we have to engage with. So I'd urge people to just have a look on there. We try and keep a regular update. We are running a survey, so people have talked a lot today. It'd be interesting, wouldn't it, to have a grid today of all of the areas that have been talking around the events that they're doing over the coming months, and the surveys. We have a survey that's running, that's helping our shortlisting process, going from a long list to a short list. I'll talk about that process in a bit, but it's we're running it for about 10 or 11 weeks, and the purpose of such a long run-in is because we're collecting some demographic information. We want to make sure that if there are gaps in the people that we're targeting in getting certain groups or communities in coming back, that we then make a concerted effort to go back out and look for feedback from those groups. So that's why it's kind of running. But we launched it almost 2 weeks ago now, and we've already had 2,000 responses. So it's quite a good uptake so far. So fingers crossed that pace will keep going, because the hospital is obviously important to everybody across not just this patch, but soon to be in the Bob ICS arena as well. So we've heard about the Bob ICS, and this is just to remind people that any plans that we have must be done in conjunction and collaboration with the Bob Integrated Care System. And some of the discussions that are taking place are our directors of estates and facilities, for example, are coming together across the patch to see where can we look at using estate better and collaborating on estate. We're doing that in digital, we're doing that in workforce. So there's a lot of discussions around where we might collaborate. So how that might make a difference? Well, for example, if we're really good and don't have waiting times for a particular operation, if we're really good at ophthalmology, for example, we might provide that service across the patch, because you'll get seen quicker, because that we have the workforce and the resources here to do that. Equally, it might be that there is other things that Oxfordshire or Buckinghamshire are good at that we might, because we can access quicker. So those are things that might slightly change where we might get services going forward in the future. So just to remind people a bit about the what the trust consists of, we do have 7 sites, so a lot smaller sites. We've got sites in West Berkshire and Townlands, and they operate with outpatients and diagnostics, and some urgent care is also provided in Bracknell, and minor injuries in Townlands, and so taking some of the pressure away from some of the front door, but also some providing care closer to home. So we are trying to maximise the space that we've got in those areas, and how we use those will affect what the final hospital will look like. A quick reminder of the kind of activity that we've got and how many staff. Actually, we just did a couple of weeks ago a bit of a review of how many staff, and actually it's closer to 7,000 staff at the moment. And what's important about that is these are staff that, and so it's the largest employer in Reading, but they're staff that live in the local areas, so they're not people who, large groups of people who work from home in the other side of the country, or we do have some of those, but generally they work in the local community. So we were put on the new hospital programme in 2019, and this lists out the reasons for being on the new hospital programme. We've got huge condition issues with our estate. We've got grade 2 listed buildings. We've got a estate that actually has grown over the years, and we've had add-ons too, and hasn't been, we're restricted in terms of our land. So there's lots of maintenance and backlog maintenance issues. A couple of years ago, there was an estimate to fix all of our backlog maintenance issue is it approximated £200 million. So that will give you the scale of the work that is required just to the estate to fix the maintenance issues. We've also got issues around capacity to deliver the care now and care for the future. So national standards coming down. You may have seen that there is going to be guidance now that all new hospitals will have single rooms, so it won't be wards. So, even if we didn't increase the amount of beds that we currently have, and we're not looking to increase that actually by a huge amount because there are such advances in digital and virtual wards, and people who have operations in the past you might have been in for days or weeks. Now you can have an operation and go home the same day. So that really does impact on the number of beds that we need. But if we had the same number of beds, we'd need a huge amount more space because of the single room occupancy and ventilation issues, and also the ways in which we, which services are next to each other, and the space required for new equipment, and the space required for new types of patients who come in with multiple conditions. So the space is significantly more. And there are other issues such as the climate and becoming net zero, and the capability of our buildings. So, going forward, I suppose an example would be, wouldn't it be great if we had single rooms, and as people start to get an infection, that room detects that straight away. And you don't wait for a nurse to come around and take your observations, which by that time might be an hour later, and half the ward has got that infection. Actually, you can build digital environments now where you can isolate infections much more quickly by having that built into the infrastructure. And so that's just one tiny example of how we need to build hospitals that enable that faster detection of infection, as an example. So lots and lots of reasons we got put in the hospital programme. So quickly about the new hospital, and we set out our case for change, and that strategic case was put forward a couple of years ago now, but has been, since we've last met, it has been approved as a ministerial approval with all our cohort 4, which is the grouping that we're in the new hospital programme. And the options within those range from redeveloping on site, and there are 2 options for that, which range between 789 million and £1 billion, which is on-site redevelopment, to a brand new hospital on a brand new site for 1.3 billion, and that was estimated two years ago, probably 2.5 years ago now. So those are the options put forward which also eliminates things like the backlog maintenance, for example. So when it's not an insignificant amount of work that is required to bring the hospital up to standards fit for the future. So just to say a bit about the new hospital programme, the idea being, and I actually think, the right idea, if we are to build 40 new hospitals, which was the government commitment, the 40 new hospitals by 2030, and we all have the same standards in terms of space and ventilation required. If we're building if we all need a brand new intensive care unit, that intensive care unit should, if they have the same standards, surely we could design one or two versions of that once and then use those. So it's talking about standardized designs rather than using 40 different designers and architects and all of that to do that. So it does, the economies of scale to do standardized design is, absolutely makes perfect sense. Also, if we were all to go out looking for all these suppliers to build us these new hospitals at the same time, we would have a problem jamming up the market and increasing prices. So the market needs to be managed to do that. So the idea and principle around that is good, and the new hospital programme have been developing an approach to standardising things and centralising things since it launched in 2019, and it went recently to Treasury to seek funding for the total programme, and my understanding is there is a potential agreement on the total funding for the new hospital, but we don't know what that funding agreement is, and that in part is because there are additional pressures on that funding coming from RAC hospitals. So I don't know if you know much about that, but since the new hospital programme launched, there are 8 hospitals that have been identified, Frimley is one, with a type of concrete that has a lifespan that's ending, that's starting to crumble, and it needs things just to keep it up. So there's a huge amount of risk involved in those hospitals that have been built using RAC, to put it really simply. So there were 3 already on the hospital programme, and there are additional 5. So the envelope, I think the sticking point is the envelope has to accommodate those additional 5 hospitals, as well as the current hospitals that are on the programme. We have had communication before Christmas to say that they are expecting a funding announcement in February. So that's the strongest indicator of an announcement we've had since I've been on the programme in 18 months. So I'm excited at the prospect that we might know what the funding is. So it's a shame we don't know yet, but we are hopeful that in February we will know a bit more about what our funding envelope is. And the funding envelope is going to drive the type of build that we are able to do. So whatever that funding envelope is, we then need to have discussions about what does that mean for whether it's on-site or off-site, but also we feed into those discussions the engagement that we've been doing over the last year with the community, but particularly now we're going through a long list to shortlist process, and those will feed into those discussions about where the investment should go. So this diagram also highlights just at the bottom some of the activities that we've been involved in, and again you can see all of that on the website, but we've been developing our clinical model. So what does our new clinical services strategy, what does that look like in practice? If our ambition is to deliver more care closer to home, what does that mean in terms of the size of the buildings that we need? So we are doing that detailed work now as part of the outline business case process. So lots of challenges in terms of planning. For example, if we stay on the current site, the only way we could generate enough space to accommodate what we need for the future is to think about building up because we can't build out because it's a landlocked site. So we have been talking to the guys here at the planners in the council around what our potential options and opportunities might be, given we are also surrounded by a conservation area and residential accommodation. So there are restraints there. There's also constraints in terms of the traffic to get in there. So ambulances regularly have trouble getting in, particularly from London Road and the Craven Road, and has a real big impact on getting into that site. So the site currently absolutely could accommodate improvements, absolutely is a great location for many things, but also has a lot of constraints too. And then if we were to get enough funding to build a brand new site on a brand new hospital on a new site, we're currently out looking for sites now to put into the mix. So the issues relating to sites in other places is, have they got the infrastructure now? We are still working to a deadline of delivering by 2030 a new hospitals wherever that is, and if we are to be successful in that, we need to, and it's to a new hospital on a different site, we would need to find somewhere fairly quickly that has the infrastructure, has the ability to get the planning permission and all of those other things before we actually start to build the hospital. That said, the new hospital programme's standardised approach might mean that building the new hospital, once that's all sorted, is a lot quicker than previously would be done. So there are also lots of opportunities with being on the programme. So uncertainty about funding, managing current risk, that with delivering as we are, there's lots of risk with the current infrastructure that we're having to manage, every day really. Net zero carbon is also a challenge in terms of reaching targets, but lots of opportunities to improve for health improvement and for workforce. So some of the things that we're struggling with now, and is the new Elizabeth line, for example, is giving our clinical staff greater access to London, which has London waiting and other advantages in a way that hadn't done previously. Our estate is something that will stop people from applying to the trust. So, we do need to think about those things, and we are developing, doing lots and lots of work about developing our workforce early, in schools, and doing lots of outreach work there. But, our buildings is a big barrier to people wanting to come. I think since we last attended, we have progressed the strategic case, which is a good milestone. There are 3 stages to securing funding for Treasury: the strategic case, an outline business case. That's where we're at the moment, and then the full business case is once we've the outline business case has decided what the preferred option is. We then look to procure the contracts for the preferred option, which of course we haven't started yet because we need to go through the business case process. We're developing various different options quite regularly for the new hospital programme. We get quite a lot of requests for different options. What could you do with this envelope? What could you do in this place? So our team tend to be working on delivering lots of different information so that the new hospital programme can look at and take that into account in designing the programme as a whole, and the scheduling and the costing. Engagement with staff and patients and public, lots of engagement happening. I mean, the survey itself, we did that in collaboration with the councils and with Health Watch in terms of developing what the questions would ask. We've got some engagement events coming up. And as I said, I think, we should be working probably closer together on sharing some of those, and more than happy to do that and share information in those. We've got, I guess what I'd say is quite hard to keep people engaged when we haven't started yet. So it's quite a big ask. It's like, is it really going to happen? Is it, is that we've been talking, and for some clinicians who have been working at the trust for, probably best part of 30 years, have been probably talking about a new hospital for 20 of those. It's really, really hard to keep people excited and interested when the conversations have been going on so long. We've been building the team, and when you go on the website, you'll be able to see the program team, but we've also got seconded people from across the organisation to help us half a day or a day a week to help to do that. And we've been talking to today I gave a talk to the Ethnic Minority Staff Forum in the Trust around looking at flexible ways to encourage people from across the community to come and work with us, and we would look at how do we support payment for those. So we know, for example, that going into certain communities, there's no point in me doing that. It's best to be delivered by people who come from those communities. And so if there are people out there who are well connected in certain community areas and we've got a gap in terms of our engagement, we would be more than welcome, we'd welcome a conversation with people around how do we support people already in those communities to have conversations that we wouldn't ordinarily be able to have. So that's something that we've been talking to our staff forum about, but it's an open invitation to the people here in this group as well. Yep, just in final summary, this is our current focus, waiting funding announcements, developing our clinical model. We've got a lot of work going on there at the moment, looking at different pathways. So and you'll see some information about that on the website also, and ways to get involved in that. Shortlisting options. So part of the outline business case process, it's quite a structured framework. You have to agree your success factors and investment objectives, and without getting too technical, you start with a long list of options that's been developed through engagement, and then you have to go from that long list to a short list. And so that's what the survey is around, is to help with the shortlisting process. So it's asking people what's really important to you. Is it, and how would you prioritise some of the services that you receive? So is it really important that the hospital stays in Reading, or that some services are closer to you than they currently are? Those sorts of things are around helping us to prioritise what services we put where. And there's lots of information around engagement events and the survey on the website. So any questions on that?
Thank you, Alison. Thank you for that update. Do we have any questions? Andy has a question.
As one of those old fossils who's have worked in the health system here for over 20 years, and I was a junior doctor at the Royal Berks, and I saw it being redeveloped last time. I would be an advocate for looking for a new site and building an eco-friendly, full state-of-the-art new hospital for the future for Reading and for Berkshire Berkshire West for the next 50 to 100 years. I think staying on the landlocked site would be a short-sighted probably solution. I thought of that last time we went through this process 20 years ago. But I know Councillor Brock's very passionate about being a Reading hospital. I think we still need a Reading facility, possibly on the same site of some sort. There's the whole thing about diagnostic centres, community centres and facilities for our community in Reading. But an acute hospital, and I know because I've worked as a junior doctor in acute facilities, in the emergency department, the ITU, on the wards and the theatres, you really need space and you need a proper state-of-the-art hospital built. And I would encourage you, well, if the funding allowed, to take that leap for the future, it would be more better doing now than rebuilding on the same site and in 20, 30 years' time having the same conversation again. But thank you for all the hard work you're doing. I have done the survey.
Thank you, Andy. Do we have anybody online that's got any questions? Yeah, that's what I was thinking. Martin, did you have a question?
The next item.
Oh, apologies.
No, thank you, Chair.
Apologies. Okay. Just making sure I haven't missed anybody. Thank you very much for the update. It was really, really useful. Such an important topic that we obviously all have an interest in. Recognise the time frame of this project, and developments will happen over a period of time, but really looking forward to, I think you said February, when we'll get more of an update. But, thank you very much for all the work that you're doing as a team. It's really informative. And the presentation is very helpful, actually.
Okay, thank you. And I think I'm coming to the ACE committee in March, so I think if we do have an announcement in February, hopefully I'll be able to update as to what does that mean in March. But you know, I'm happy to come back, and if we do get funding, to come back and report.
Yeah, I think that would be really useful actually, because we'll, as you say, we'll know more.
Yeah.
In a few months.
Okay. Thank
And
you.
you mentioned that there may be small tours available, so I don't know if that'd be open to Health and Wellbeing Board members.
Yeah, absolutely. I think it's so beneficial for people to see what some of the issues are actually, and we've had counsellors from West Berkshire come, who, you know, before they saw some of the issues that we were having to deal with, had a different perspective on voting certain things or pressure for certain things. And when they saw some of the conditions for themselves, they said it was really eye-opening. So I'd encourage, and we would welcome anybody who wants to come from the board to come and see for themselves. I'm happy to do a tour.
Thank you. That's really helpful.
Thanks.
Thank you. Well, thank you very much then, Alison. Thank you. Right, then we're moving on now to agenda item 14, and we have Martin with the COVID-19 and Reading vaccination update.
Thank you, Chair. What I'd propose to do is just run through the headlines. Everybody will have seen the paper that was tabled and circulated by Nikki. So if that's okay with you, I'm going to just go through the headlines.
Yes.
The week ending the 15th of January. So based on the ONS survey estimates, 2.61% of people in England, that's 1 in 40, tested positive at the end of week ending the 10th of January. There were 84 cases in Reading, that's 27.4 per 100,000. That's the same week. Hospital admissions have continued to decrease to 6.69% per 100,000. That was the week ending the 15th of January 23. Admissions to ICUs and HDUs have decreased slightly to 0.23 per 100,000. There were 9 admissions at the Royal Berks on the 2nd of January. But deaths in England sadly rose from 367 to 839 the week ending the 6th of January. So the general trend is downwards apart from the deaths, and the overall summary is the same for the weekly National Influenza and COVID-19 surveillance report for the 19th of January 23. Which reports decreases in influenza positivity, influenza-like illness consultations in primary care, hospital admissions and emergency admissions. That was in week 1 in January. I think overall the summary is that since COVID reached the UK in early 2020, more than 500 million tests have been reported. More than 9 in every 10 people aged 12 years and over have received at least 2 vaccinations, and more than 150,000 people have died, sadly. Vaccines have effectively reduced the impact of infections on hospitalizations and death, but the emerging variants have been much more transmissible. The hospital admission rate and number of deaths involving COVID-19 are lower now than earlier in the pandemic, despite similar or higher infection levels. So I think we're seeing partially the success of the vaccination programme. COVID infections have continued to decrease, as I've said, and same with the hospital admissions and ITU, HDU admissions. Study is continuing into the impact of long COVID, which was affecting 2.1 million people. That's 1 in 30 across the UK in December 2022. And it remains important, therefore, for us to continue to promote the uptake of the COVID booster and flu immunisations, particularly amongst underserved communities, to protect vulnerable members of our communities and reduce demand on health and social care workforce. Thank you.
Thank you, Martin, for that update. Do we have any questions or comments? Nope. Okay. Well, thank you very much, and we note the report, and thank you.
Thank you.
Now, the next agenda item is yourself again, then.
Indeed.
Yeah, which is the the Vaccine Champions Programme update.
Okay, I'm going to try and share my screen. I think I am able to do that. So let me just quickly share my screen, and hopefully everyone on the call will be able to see this. I'm going to run through these very quickly as well. This is a quick headline summary, and this is the Community Vaccine Champion Programme that has been implemented by the Public Health and Wellbeing team, and talk about the programme evaluation, where it's at the moment, and progress towards a possible phase 3. As a reminder, you'll see that the programme management concluded on the 31st of October, and most of the, well, all of the RAG rating indicators are green. At the top of this slide for the programme management, we've got some notes there about the evaluation completing, and that has now moved on. If you see the bottom half of this slide that I'm showing now, the update is that in the centre, the first row there at the bottom, the evaluation report is currently in the final stages of editing and design. We've received the draft report back from the University of Reading, where Professor Carol Wagstaff is very kindly editing and contributing some academic oversight to it, and it will be published in the first half of February. And some of the data is going to be included in this the report, but just as a summary, we've got 50 community health champions recruited. We've also run 33 pop-up vaccination opportunities. 250 individuals have been transported to vaccination sites. 7 community grants have been provided, and 3 priority groups identified and engaged with. So there's a lot of great activity that's taken place that we're able to report on. The evaluation itself captures the activity, the data about the measurement of the success and the outcomes of the programme, and will be used to inform partners and stakeholders, including the funders, which was the Department of Levelling Up Housing and Communities, and other local partners in the system. The evaluation report, when you see it, will be designed. We put some time aside and some resources to make sure that it looks readable for all partners and stakeholders. It will report on the delivery and outcome of the 6 key work streams and the overall programme management. The essential approach has been to take a public health case study approach. So there'll be a lot of narrative and a lot of qualitative as well as quantitative data in there. And the whole team has been involved in this, along with our partners and the University of Reading, as I said earlier. The preliminary findings I can share with you is that there was an increase in the take-up of dose 1 COVID-19 vaccinations by nearly 300%. We'll be able to give more of a breakdown of the actual numbers for that. There's been some problems because the denominator changed as people sadly died, and the expressing the improvement as a proportion didn't fully represent the gains that have been made by the programme. So there's been some thought put into how to present the complexities of that. We did also have to wait quite some time to get the data back from the Foundry, which we lost our access to for 2 or 3 months in the autumn. But happily that's been restored, and we're able to complete this the data part of the evaluation report. We've worked closely in partnership with ACRE, the Alliance for Cohesion and Racial Equality, and recruited and trained 50 champions. 61 people have been trained, and a high proportion of those have reported that they feel confident now in having conversations about the vaccination and more generally about health and well-being. There's been 51 engagement events, successful outreach to vulnerable groups, including those who are without a home, sleeping rough, and people who are grappling with the substance misuse and refugees. And there are areas in Reading that have been targeted as part of the programme, and there's some listed there: Kennet Island, Palmer Park, South Reading. 10 small grants were awarded to local community and voluntary sector organisations to strengthen their work to improve health outcomes for their communities. And there's been a very successful and quite interesting communication strategy, which has included the ad bikes, and we're using images of that in the evaluation and also the application to the MJ Awards. A little bit now about the sustainability partnership and a possible phase 3 phase. There's 3 elements to this. There's the ongoing Community Champions Network, there's a training programme from them, and their work support things like the Oxford Health's Health on the Move van in Reading. The sustainability and partnership role, the aim is to maintain the partnerships that have already been created and to build capacity and ownership amongst the existing outreach initiatives. We want to try and consolidate and build on the legacy of this, and I know there's a huge amount of interest amongst members of this board and other stakeholders and partners across the system. We want to provide some forward planning with an analytical approach, and essentially to really see if we can identify sources of future funding and ways in which we can align the champions to the ongoing work across the system in Reading. So these are the deliverables for the Sustainability and Partnership Lead: to prepare a PowerPoint communication product which we can use with partners to describe where we've got to and what's going to be happening next, to provide a list of all the possible sources of funding and dates of the funding applications to be submitted. We're hoping that the evaluation report is going to stand us in good stead for that. We're going to be creating and refining the stakeholder map to consider future collaborations and funding, preparing a report for a potential phase 3 plan programme, which will include the objectives, KPIs, costs and delivery plan. And I know that work has started to develop that in partnership with our, in partnership with community groups that we've been working with. We need to understand the programme evaluation case studies and contribute to those in the report back to DLUC in March 2023, and also to act as a signpost and to inform charities about funding opportunities and sustainability avenues. So we're aiming to extend the network of community health champions. There's an idea to change the name from Community Vaccine Champions to Community Health Champions. Support with the ongoing coordination and support for the Champions Network meetings, develop a training offer which will include trauma-informed and wider health information sessions, development of an online toolkit for the Champions Network, and linking the Champions Network, as I said, to other community events and aligned locality projects. Just so this isn't all chalk and talk, there are some of the pictures there of some of the groups that have taken part in this really valuable and important work. It has so many different outcomes apart from just promoting the uptake of vaccines. There's a picture of an ad bike there on the bottom if any of you are wondering what one of those look like. Quick one about the finance update. The phase 2 underspend being reallocated, as I said, to the sustainability and partnership role. That includes a small contingency fund to pump prime and support the role and the associated development activities. That role has been supported by colleagues in the Public Health and Wellbeing team on top of their existing work, and they're developing the training offer, including making every contact count and other training options for the network of champions. Mental health first aid is another one that's included there. And this planning is ongoing at the moment for a celebration event with the programme partners and stakeholders to develop the Champions Network. So hopefully that will have provided everybody with an update on where we're at with the Community Champions, Community Vaccines Champions programme. Thank you.
Thank you very much for that update, Martin, for that presentation. Do we have any questions from anybody? No, I can't see anybody online. Thank you very much. Thanks for the updates on this really important project. It's been really interesting to see how it sort of developed. It's very good work. I'm glad to see how it's evolving beyond the COVID vaccination into sort of broader health champions. and look forward to seeing the evaluation report. So thank you very much.
Thank you.
Thanks, Martin. Pardon me, don't have my mic on there. If we move on to agenda item 16, and it's Reading Armed Forces Covenant and Action Plan, and we have Jill here, Jill Marston, to present. Thank you, Jill.
Thank you. Yes, I'm Jill Marston, Policy Officer at the Council. Sorry? Oh, move it closer. Okay. So I'm just going to give a really quick introduction. So this report is the annual update on the Reading Armed Forces Covenant and Action Plan, which is included as an appendix. So a particular note this year, there's a new statutory duty on public service providers as part of the Armed Forces Act to pay due regard to the Armed Forces Covenant when writing policy and making decisions in relation to healthcare, education and housing. So the duty came in the autumn time, and in response, the Council's now incorporated the Armed Forces community into our equality impact assessment. And we've also rolled out training for frontline staff, particularly customer service staff. Also this year, there was the launch of a new PAN-BARC civil military partnership in July. So the aim of that really is to share and coordinate covenant-related action plans and initiatives across Berkshire. The report also pulls out some key activity against the health and wellbeing related actions within the overall Reading Action Plan. In particular, regarding the programme for encouraging the coding of veteran status by GP surgeries. And also there's a section outlining the sort of armed forces related actions being undertaken by the Royal Berks Foundation Trust this year. And finally, I just wanted to mention we've now got the 2021 census data for the number of armed forces veterans, which is just over 3,000 for Reading and just over 22,000 for Berkshire. So happy to take any questions.
Thank you, Jill. Andy Tchaikovsky's got a question.
That last statistic was telling that we still struggle to get veterans to declare themselves at the surgeries when we know there's so many more of them out there. Is there any way through is there a sort of veterans organisations that can ask them to let us know? Because I'll question them on when they come in for their flus or whatever, or whenever they register with a practice, but there's obviously a gap between them being asked and then letting us know.
I mean, yes, I guess the charities could be made more aware and encouraged to spread that message. I'm happy to sort of ask them to do that more than they're doing already.
Yeah. There may be a reluctance amongst veterans to declare themselves as veterans. I don't know whether that's the sort of thing, but you know, we do ask, because we do then try and be more aware of the potential problems they may be facing, and that helps. And it usually comes out, you know, incidentally. Yeah. So it is a tricky area, I know. Thank you.
Yeah.
Thank you. Do we have any other questions or points? No. Well, thank you very much for the report. Thank you for the presentation today and the update. I was actually going to raise the same question that Andy raised, and I was looking at the information, the action plan, and you know, most of the things were achieved and there was some outstanding, so it'd be useful to have an update at some point to see how things are progressing. But thank you very much for your time. Thank you, and the presentation. Right, if we're moving on then, the next agenda item is 17, the Berkshire West Place-Based Partnership Unified Executive Chair's Quarterly Report, which is Andy Tchaikovsky is here.
Yep, I'll present, Chair, thank you. I'll be very brief. I'll take it as read, but I'll just pull out a couple of themes. Obviously, we've had quite a lot of mental health themes today in the meeting, so just to say that in the Unified Exec also, there are a number of mental health priorities which are under their sort of scrutiny and monitoring. There was mention about the ICP strategy at the beginning of the afternoon. So that was also presented recently. There's the place-based partnership development. I think Sarah mentioned that about getting providers across Reading working together. There was a workshop earlier this month, and there's going to be ongoing work about how can we make sure that what we do here at Place in Berkshire West and across the 3 localities within Berkshire West, we can work most effectively for our local place, even though we are within a bigger Bob ICS. And part of that benefit of working together, I think, came across when there was an announcement of funding, national funding for discharge funding for adult social care, when the system came together with both the Bob ICS staff, local authorities, the Urgent Emergency Care Board came together to put a proposal to the national team how we can spend that money, and manage to get 3.5 million allocated into the Berkshire West system to support discharging patients out of the hospital. That had to be done in a very agile manner between committee meetings. I think, Chair, thank you for supporting that process. So just a sign of how we can work together and be agile because we're all working for the same system. Thank you.
Thank you, Andy. Do we have any other anybody who wants to speak on this? Any questions? No. Okay. Thank you. We're happy to note the report. Thank you. So moving on then. So agenda item 18, the integration programme update, and we have Bev Nicholson online. Hello, Bev.
Just very quickly.
Bev, we can't hear you.
Helps I put my microphone down. Thank you.
Yeah, that's
just because I'm conscious of time, I would just ask people to note the report, really, the assumption that it's been read, draw to people's attention the addition of the Adult Social Care Discharge Fund. The plan was shared, and that we've met 3 of the 4 Better Care Fund metrics. So that's really the highlights of it. I think we've got some pretty good outcomes so far, but I'm happy to take any questions about the report.
Thank you, Bev. Do we have any questions or comments? Nope. Okay, thank you. Thank you for the report, and we're happy to note the contents. Thank you very much. Thank you, Bev. Agenda item 19. So we have the Health and Wellbeing Strategy Quarterly Implementation Plan, Narrative and Dashboard Report with Amanda. Hello, Amanda. Hi.
Hello, thank you, Chair. So I'll try and keep it as brief as possible. Just providing a quick update on the performance and progress to date of the priorities of the Health and Wellbeing Strategy. Again, assuming that the report has been read, I will focus on just a quick update in relation to the data elements. So for priority 1 and 2, which is being led by the Reading Integration Board, the key things that stand out as a result of the data are that cancer and mental health are the conditions that are linked to early mortality and disability. And the recent data shows that the relative risk of these is higher in areas of deprivation in comparison to the wider NHS commissioning area. So something to be mindful of. And the targets have been set to reduce this in line with the wider area. I just wanted to point that out because those are the 2 that were quite stark in comparison to the other conditions. And looking at priority 2, again, if we're looking at the data overall regarding inequality in life expectancy, we can see that in Reading we are better than the target that has been set. So with regards to that element, we're progressing quite positively. And then going on to priority 3, which is focused on helping children and families in early years setting, there is quite positive progress across all priorities. and the data is showing that we're performing well, again, across most targets relating to this priority. However, I just wanted everyone to note that there is some data that is still yet due to be published because it gets published on an annual basis. So this is why you'll see some of the tables empty. There's no recent data. Likewise, with priority 4, the One Reading Partnership and SEND Strategy Group on Mental Health and Wellbeing for Children and Young People are performing really well. There's some really positive progress in all priority areas. But again, I wanted to sort of pull out the data which relates to children and young people engaging in mental health support teams. So the data is showing that most of the children have moved closer to their goals, and likewise with the support that's being received from the primary mental health team, the data again is showing that the children and young people, the majority of them have moved closer to their goals. So overall, progress is really positive. But in a similar nature to the data for the first few priorities that I mentioned, there are some elements that haven't been updated because data needs to be updated on an annual basis. And then last but not least is priority 5, which is focused on promoting good mental health and well-being for adults. Work is progressing in all priority areas with particular development around improving partnerships, working and training. Understanding of the wider system and services is also improving as the group work together and share insights from their services within their teams. And in relation to data, the performance data indicates that the number of people who've been diagnosed with serious mental illness has unfortunately increased if we're comparing Q1 to Q3. So there may be various factors at play here, but again, in this, there's been some mention around the cost of living that may be contributing to some elements as well. Because as you can see, the comparison from Q1 and 3 is notable. And a similar picture is seen with depression diagnosis. There is only a slight increase, but of note is that the rate is higher in Reading's most deprived areas compared to the total Reading population. So this does highlight inequality. But again, I'm aware that there are some projects that are being developed and some already in action that are working to target this. And then last but not least, the drug and alcohol outreach support to street homeless populations. The data indicates improvement overall with regards to those remaining in treatment for at least 3 months and those receiving a health intervention. So across all 5 priorities, I would say the performance data generally shows really positive directions of travel, and there are some elements where more work needs to be done, for example, mental health, which has been highlighted in many of the discussions. But happy to take any questions.
Thank you, Amanda. Do we have any questions or comments from colleagues? No. Well, thank you very much for that presentation. Thanks for the report on the progress and on the delivery against the strategy. Thanks for bringing to our attention the performance and areas to keep a focus on.
Thank you, Chair.
And it was really helpful, so thank you. Thanks very much. Right, we're moving on then to almost the final item. The agenda item 20, which is Health Watch Reading Work Programme July 2022 to March 2023. And we have Sarah Deason and Alice. Oh no, sorry, apologies, Alice is presenting.
Hello, good evening, everyone. I'm Alice Kunyupi-Clifton. Thank you for having me, Chair, and it's a privilege to be here. I know it's very late, so I'm going to be very fast. And if I speak very fast, do tell me, because I have a tendency to do that. But so the whole idea of me coming to you guys is just to turn around and tell you that Health Watch is still here. We can't go away without legislation. So, you know, it's a statutory requirement. So it's a new provider. The advocacy people host Health Watch Reading, but you know, HealthWatch will be here, but it's a new team. So the thing is, what we want to share with you is our work plan. I hope you've seen our work plan and the presentation. Is there any questions that you want to ask from the work plan? Nope. No.
No questions right now. Thank you.
Okay. I mean, so the thing is, one of the things that we are doing is making sure that the public voice is heard. And so in the local level, it's been heard, and then in the ICP it's heard, and the ICB is heard. We have a seat in the ICB as well, and whatever issues that the public shares with us, we will take it as far as HealthWatch England as well. So the voice is always heard. So we try and make sure that there are changes. So we've shared with you our objectives, and also our work plan and our wish list and watch list. And at the moment, one of our watch list has become very evident to us is the asylum seekers, who are the people that are here, and they're struggling with their status. Their conditions are really, really sad to hear. So we are championing them at the moment. So we are talking to public health to try and see, under the health inequalities agenda, how we can make this better for them. So that's one of our activities at the moment. Thank you.
Thank you very much, Alice. Do we have any questions from anybody? No. Thank you very much. Thanks for the report. Thanks for the report and the update on priorities and objectives. I appreciate all the work you're doing to ensure the voice of the people is heard. And it was really good to meet with you on Monday and learn more about the work you're doing. So I look forward to working with you.
Yeah, I mean,
thank you very much.
Please use us anytime you can.
Yeah, thank you very much.
Bye-bye.
Bye. Okay, so the final item on the agenda is the date of the next meeting, which is the 17th of March 2023. So thank you very much. That's it for today. I think it's been a long meeting. I can barely talk now. So yeah, that was the one. Yeah, so thank you ever so much, everybody, for your input, and thank you very much. Right, bye.